Tonight on Nightline.
It is supposed to provide life-saving treatment to those with HIV, but in a cruel twist of irony, this drug is having the opposite effect for many in South Africa, a country with one of the highest HIV rates in the world. Too many are abusing it simply for the high, and that just might compromise the HIV fight. Jim Shudo now with this report.
This is the illegal drug sweeping the townships of KwaZulu-Natal, South Africa. It is cheap and powerfully addictive.
I think we lost your friend.
He's okay now.
We witnessed the drug's effects up close on a 17-year-old addict we'll call Joshua. A high school junior from a middle-class neighborhood in Durban, he said his parents would kick him out of the house if they knew. And yet he smokes every day before and after class, despite his dreams of becoming a doctor.
Describe exactly what you're feeling now.
It feels like you've got no problem in all. Like yesterday, if you killed a person and you smoke this thing, you won't remember that you killed a person yesterday. It's so cozy now. I want to sleep. I want to sleep like cool.
The drug they're abusing is meant for something very different. It is the anti-retroviral Efavirenz. When taken properly, part of a life-saving treatment for HIV patients. When crushed and smoked, a cheap high with no medical benefit.
They've just finished smoking, and it's pretty clear they didn't have to hide. Everyone in the neighborhood seems to be aware of what they're doing, and the same was true when they went to buy the drug.
South Africa has one of the highest HIV infection rates in the world, and KwaZulu-Natal province the highest in South Africa, 40%. For the infected, anti-retroviral drugs, or ARVs, are the only thing standing between life and a painful death. The tragedy here is that this drug is so cheap and plentiful thanks in part to a well-meaning effort by the American government to distribute ARVs, a program which has helped extend the lives of more than 200,000 AIDS sufferers. But as the medical director of one U.S.-funded clinic told us, ARV abuse is threatening to turn this HIV success story into a health crisis.
How do you feel about that as a doctor?
It's extremely frustrating. It's extremely, discouraging, because on one end, you're trying to fight this epidemic that has ravaged the world so much, and the results are catastrophic.
How ARV abuse began is uncertain. Taken as prescribed, Efavirenz can cause vivid dreams. Someone, possibly an HIV patient experimenting, discovered that smoking the drug greatly enhances those hallucinations. Today, some of the illegal drugs come from HIV patients selling their own life-saving medication for profit. Others are stolen from patients and pharmacies.
Pharmacies here have bank-like security. The drugs are kept behind vault doors. There's another locked gate here, and that's because they have enormous black market value. Just one container like this worth $60 US. The whole shelf, $3,000 US.
There is somebody who's
selling them.
Driving through the townships, an HIV worker showed us the extent of the black market in ARVs. She saw drug dens everywhere. One she identified had children playing right outside.
The man here, he owns the house.
Yep.
He built all these rooms.
Right.
He sells.
He sells.
Yes,
So he's built rooms in there for people to use the drugs.
There's one room where his customers stays and crash and do things.
Crush the pills.
Yes, and smoke.
And then smoke them.
The few police we saw did nothing. In just 3 years, ARVs have grown from a niche drug abused by a small number of HIV patients into a widespread addiction, increasingly among young people.
Many ARV abusers are teenagers as young as these students. And in a neighborhood like this one, you'll find dealers on almost every street, selling to students during school hours and just after.
Yes, that's how it goes.
In his house that doubles as a drug den, we met one of the dealers face to face. Dinda, he gave us a false name to hide his identity, told us he earns many times what he could if he could find a job.
But these are drugs that should go to people who have HIV.
Because nobody can give you that money. while I'm sitting at home, I have to go and do something for myself.
Recounting a story that's not unusual in the townships here, he told us he's the only one of 8 siblings still alive. The others all victims of HIV or gang violence, leaving him to take care of a large extended family.
And what does your family think?
I'm unemployed. For all these years, I'm not working. If I can stop this, we can all suffer. You see.
Yeah.
So they shouldn't blame me for what I'm trying to make a living out of.
For the families of abusers, it's a very different story. ARVs are powerful enough to turn even young people into violent addicts. We met Dudu, who told us her 21-year-old son steals from her to pay for his habit.
Dudu, it must be a horrible thing to be terrified of your own son.
Sometimes, if I said I'm going to call police, he said he's going to kill me.
He said he would kill you. He threatened you. You believe him when he says that?
I believe you.
Yeah.
Now, South Africa may soon face a deadly consequence of ARV addiction. By smoking the drug, abusers are in effect giving HIV a small taste of antiretroviral medication. Not enough to kill the virus, but enough for it to potentially develop resistance to the drug.
It's almost educating the HIV.
Yes, educating the HIV, exactly. And so you'll find that we have a second epidemic emerging, an epidemic that we cannot control with the current drugs that we have.
25 rand.
Back in the drug den, the teenage addict Joshua told us what happens to HIV patients isn't his problem.
Does it ever make you feel guilty?
What is that?
Using drugs that are meant to help people with HIV?
I feel guilty sometimes, but hey, I know that all I'm doing is wrong, but what I started, I must carry on.
The cemeteries of South Africa are already crowded with victims of HIV. Now, a new danger is threatening to put the country's best defense up in smoke. I'm Njabulo for Nightline in Durban, South Africa.
Well, that's grim. A potential public health crisis there. Thanks to Njabulo for that.